The information in this podcast is for entertainment purposes only. Consult your healthcare provider for proper care regarding your specific situation.
Welcome to Rattle Nurses, the podcast that's here to shake things up when it comes to pregnancy, breastfeeding, and postpartum care. Hosted by two experienced nurses, we're bringing you real talk, expert advice, and a whole lot of laughs as we navigate the wild world of newborn care.
Whether you're a first-time parent or adding another little one to the mix, we've got the tips, stories, and answers you need to make this journey a little easier and a lot more fun. So grab your coffee, even if it's cold, get comfy, and let's dive in.
All right, welcome back. Happy episode 13.
Lucky 13.
Is it 13? Okay,
It is
it's 13. All right, so today we're going to be talking about doctors, vetting your OBGYNs and your pediatricians. But first, some jokes. You ready?
All right.
Okay.
I'm ready.
Okay.
You going first or me?
I'll go first.
Okay.
Okay. So, why did the beekeeper have to go to the doctor's office? Because she had hives.
Ba-dum-bum.
That's when we need a little. Do we have our rim shot button yet?
Okay, so why did the cookie go to the doctor?
Oh, I don't know.
It felt crummy.
That's so cute. These are good toddler jokes. I like these.
Yeah, they're the ones that'll be laughing.
Yes, I know.
And us, of course.
because it's us.
Because we're toddlers.
Yeah, I know. So I still have our names. I have to leave off the names from last week just because we had a guest.
Yes,
I didn't want her to judge me too much. But here we go. Back to my names.
Yes.
All
Good to
right.
me.
I think a lot of these we've actually discussed, but this is the end of my list right now. So, all right, we got, let me do this one. It's okay. We do that one yet?
Ribbon.
Ribbon?
I don't think we have.
No? Ribbon.
Ribbon.
Ribbon?
Girl.
If it wasn't it could be either. I'd say girl. If it wasn't a thing.
Probably. Because you think bows, hair bows and that
yeah.
kind of thing.
I would say girl. I like this one in a weird, stupid way.
Feta, we have talked about that.
Feta, we talked about feta.
Yes.
A lot of the cheeses brie feta.
We did. We were going to go with Feta and Freya. And
That's right.
I can't remember the other one. We're triplets. I can't remember what it was.
All right. Okay, and we've had actually this one before, but I don't know if we've said it out loud on the podcast. I've had this as an actual name, so
Oh, yes. We did talk about that
we
one.
talked
too.
it.
Felony.
Felony, you guys. For our viewers, felony with the F, not even a PH, with an F, just like it sounds.
Like the crime.
Like the crime. I feel like I had a different one.
funny.
I know. Still, I'm like, still?
Well, I don't have any written down, but,
Okay,
go
ahead.
about retina?
Oh, retina's good.
Or, retina. Whatever you want to go with. Retina.
R-E apostrophe Tina.
Yes. It has to have an
That's
apostrophe,
what
right?
it was an apostrophe. Retina.
Retina.
And text it. Is that retina? Do you say it retina?
No, ma'am. It's retina.
It's retina. It is retina, not retina.
Can't believe you had to ask.
The audacity of you misspelling or mispronouncing my weird
And this
name.
is my sister, Ovary.
Ariola's somewhere around here too.
Yes.
Okay, good times. All right, so we're going to talk about choosing your OBs and your pediatricians, okay? You do always want to basically vet your doctors. You want to know that they're a right fit for you, right fit for your plan, your family, and your personality, your care style. Mm-hmm. So your biggest thing, of course, is when you're choosing OB, where are you delivering? Where are you wanting to deliver? If you're choosing OB, mm-hmm. midwife, what's your plan? Will they accommodate your birth plan if you have one? And basically their proximity to you. You know, you don't want to be seeing someone 30 minutes away when the hospital's 5 minutes up the road and, you know, maybe they don't deliver at that hospital. So
Yes.
Yeah.
And I must say, always check insurance as well. If you have insurance, make sure they take your insurance. Because I've run into that problem. You know, when I had my first baby, there was a doctor that I absolutely loved.
Yes.
Thought he was amazing. Even referred my friends to him. He didn't take my insurance, sadly.
That's unfortunate.
Mm-hmm.
That is
Yeah.
the hardest thing too. And now a lot of moms, I know a lot of our families who'll come in, like they'll have moved recently, and the new doctors won't be able to take them if they're too far along or if they don't take their insurance. So they're kind of stuck between a rock and a hard place of being able to continue their prenatal care as well as trying to accommodate for insurance and proximity. So,
And I also want to say, maybe slightly off point, but not really. I've had several patients who were 25 years old at the time they got pregnant on mom and dad's insurance.
yes.
And then insurance drops off mid-pregnancy, and then they have to go through filing all the paperwork to get Medicaid, and then their doctor won't take the
They won't take them
Medicaid.
back.
Yes, and then they run into problems sometimes where they're so far along in their pregnancy that no doctor will take them at that point.
Yes.
And so then they're considered a drop-in at
Yes.
the hospital because they haven't had prenatal cares in, 12 weeks
Yeah.
or whatever. It's
Or
just kind
having
of a-
just moved. I
Yes.
mean, we had a patient like that recently. They had just moved here, and they were trying to continue with their doctor's appointments, I think, in Oklahoma, so that they could still have the prenatal care, but also travel down here. So it
Yes.
became a really kind of hard predicament for them.
So, like, if you're relocating, I would say find someone ahead of time, kind of do the work, put the calls in before you actually make the move so that you can have an easy transition of care. Also, if you know that you're going to lose that insurance when you hit that 26th birthday or whatever the case may be, just go ahead and start working on your Medicare paperwork ahead of time and put some calls in as well and see if you can find somebody who will take
Yeah.
you.
Or
that you don't get
secondary
stuck.
insurance or something, whatever.
Yeah, because the prenatal care is so important, especially toward the end of the pregnancy, because that's when they do testing for gestational diabetes, and it's also really important to keep an eye on your blood pressures at that time
Yes.
because
And that's
the
when-
gestational hypertension can really kick in at that point.
And
as
that's
well.
when your appointments get a little bit more frequent.
Yes.
So you're going more often, and so you don't want to have to make those travels if you just transition somewhere else. So
Right.
it's very important, of course, your proximity. I'm a big person on Google reviews. I like Google reviews. So
Absolutely.
or just any review site essentially, because I like to know what not just the doctor themselves, but who they practice with. I like to see, okay, for example, my OB-GYN office, they practice out of a certain hospital, and I do know that I like to look at all of those practitioners to make sure, okay, I can, if my doctor's not going to be there,
Right.
which happens a lot, guys.
Yes, it does.
So, you may make sure you kind of agree with their partnership as well, because not all the time the doctor you pick is going to be the doctor that delivers you,
I would say more often than not.
more often than not.
Unless maybe you're a scheduled induction.
Yes, and even then, you may be scheduled
Not
on a
always.
Friday and not deliver until Saturday, Sunday, and
Right.
yeah,
Right.
so that's something you want to consider as well. If you're really specific on a certain person, they may not be the one to deliver you. So the openness of that. About their philosophies, you want to know their care philosophies. Are they going to accept your birth plan? What pain medications do they offer? What will they do a VBAC if you want to VBAC?
Yes. Because there's a lot that don't do that.
And also, have they done one before?
And VBAC, by the way, vaginal birth after cesarean.
Yes.
Some doctors, if you have had one C-section, completely eliminates you from having a vaginal delivery in the future. But not with all doctors. So that's something you want to keep in mind and
Yes.
ask about.
If you get the right physician and they can manage it right, and they seem like they have a good plan and you're amicable to that plan, I think that's what you're kind of looking for. But as far as that goes, if they're open, if you're wanting a VBAC delivery, and if they do them, and if they've done them before.
Yes.
Please don't find
That's
someone
very
who's just
important.
trying to pick, the first one they've done ever.
Because they can get hairy sometimes.
They
It
do.
can be a little scary, so you want somebody who's confident in what they're doing and has had a lot of success in the past.
You want to trust your physician. You want to make sure that everything's to your liking.
And so with OBGYNs, like she said, typically it may be a group of doctors. There may be multiple doctors in that group. And a lot of times, certain physicians only take call once a week. So
Yes.
if it's after office hours, after 5 p.m. or on the weekend, you may not see that doctor at all, before you go home, delivery or otherwise. So just expect that.
Just expect that. There is actually a physician that's in my my OB-GYN office group that I go see for that stuff, but he is one of our hospitalists. He has his own practice and is one of our hospitalists. So it's kind of funny to me because you see him all over the place. But so physicians practice often at multiple places, so keep that in mind too.
And there was something else I was going to say on that.
I
Okay.
think insurance proximity.
There's my old age
Yeah.
kicking in. Can't remember now. It'll come to
It'll
me.
show up.
I promise.
It'll-
when we've moved on to a different topic.
And that's fine, and you just blurt it out. Like, I remember now.
Yeah.
Or tomorrow morning when you wake up from sleep.
Yes. That's usually what it is. Because we just talked about sleep on the last episode, and that's when it's going to happen.
Yep. So it's important. Obviously, you do need prenatal care. If you're going to see a midwife, or you're going to go to a birthing center, also do your research on them. Please research your care providers, whether you're at a physician office, or a birthing center. It doesn't matter, but do your research before. Okay, a lot of people I think do that. What most people don't do is research a pediatrician.
That is right.
So yes, we've gone over this time and time again. People like to do their birth stuff, like create their birth plan, think about delivery, but what happens after? Did you do any research on a pediatrician? Did you look up who you want your baby to go see? If you haven't, you need to, because it is important that you choose a pediatrician prior to leaving the hospital. Ideally, we want you to have an appointment made for between 1 to 2 days after discharge. And we know weekends happen, but 1 to 2 days is ideal for a newborn appointment after discharging.
Yes, and I will say that a lot of doctors, I did this when I had my kiddos, and I know some people do it, but I don't feel like it's super common, but it was very helpful. I called the doctor's office when I was pregnant with my oldest. Of course, this was 24 years ago, plus 25 years ago, I guess, when I was pregnant. But I called around, and of course, I got recommendations from friends. And I called a pediatrician's office when I was around 7 months pregnant, and I set an appointment to actually take time out of his day for an appointment where we could sit down one-on-one, meet. I could interview him and ask questions to make sure that we were on the same page when it came to the care of kiddos. Because some doctors are ultra conservative, whereas others, they want to throw antibiotics at everything.
Yes.
And can't really say that there's any right or wrong, but you just have to find the doctor that agrees and feels the same way that you do.
As a parent, do their beliefs align with your beliefs? Or are you going to be butting heads throughout your child's care?
Yes.
So, yes, it is important, obviously. If you can, make a pre-delivery appointment and talk to them and see what they say. That's amazing. If not, at least you'll have something in mind, again, by doing some research.
And I've also had my kids at pediatricians' offices where you may not, you generally would have a pediatrician assigned as a primary care provider, but that's not necessarily who you're going to see. So you would also want to ask, am I making an appointment with you when I make an appointment, or am I just going to see whoever's available?
I was going to say that too, just like the OB-GYNs, like some of them have multiple physicians or PAs on staff. So, again, that's something you want to check in those and see, okay, do my beliefs align with this PA? Like, can I get along with this person as well? So, a lot of facilities, a lot of offices do have, like, on their websites, like the meet our team, thing. And you can go in there, look at the physicians, do a little research, their PAs, as well as the office staff. It's good to make an appointment because you can go to the office, see how clean the office is. If this is a good place to bring your child, or is it in the back of an alley and it needs a little help? Yes. You don't want that. So,
well, in some offices, they won't even have you bring your newborn in to wait in the waiting room with all the sick kiddos. And they sometimes have a separate entrance where they'll text you when they can bring you in, and they'll bring you in a totally separate entrance where your newborn baby is not around all the sick kiddos. So, those are good questions to ask.
Yes, and that's a good point, too, because, you have brand new, tiny newborn, maybe even having come from the NICU, you never know. And then, yes, still a pediatrician office, so you got the RSV and
all the
hand, foot, mouth disease, all the yuckies. Yeah, so that's a good point. Yeah,
everywhere. Yeah,
see how they run their office and make an appointment. See what they say. Also, if they take newborns, there are some places that are family practice, but they don't take newborns until like 2+ weeks. So if you,
which is so odd to me.
I know. I mean, a lot of that's like clinics and whatnot, but yeah. Make sure they take newborns, and it's not just like, because we don't want you to wait 2 weeks for an appointment. We need you to get your baby seen.
Right.
Yeah.
And that, that initial first appointment is so important. Like, I would say probably like the number one thing that we want checked at two days is a jaundice level. Because if that gets too high and it's out of control, by the time your baby's seen, you may be looking at a NICU admission.
Yeah. It can be detrimental. That's why we say 1 to 2 days for sure. And also weight checks, know, if your milk's not coming in as fast, or you're not feeding as much, or, something's just not right, the weight check is important as well. We need to know. So, or your doctor needs to know.
Also, there are some hospitals, the one we work at particularly has an we do have an OB hospitals, but that's not what we're talking about. Have a pediatric hospitalist.
Yes.
And that is the only doctor, and possibly their PAs or NPs will be the ones seeing your baby at the hospital, not your pediatrician that you plan to use. Whereas I know there are some hospitals, I've worked at them in the past, where we don't have a pediatric hospitalist, and we only have groups that we're calling, and there may be a particular doctor from your pediatric group that you plan to use who is on call for the group, and that's the person that would be seeing your baby in the hospital.
Yes.
Well, and I just said we don't have pediatric hospitals. Of course we do.
We do, yes.
Because the ones that come in and don't have not chosen a pediatrician, those are the ones that would get seen by the hospitalist.
Yes.
That's on.
We do have a pediatrician to see your baby. For every day that you're in the hospital, they need to be seen by a baby, and they will, they need to be seen by a doctor, and they will be, whether it's our pediatric hospitalists or their PAs. Someone will come in and see your baby, but after then they cut ties at the door, discharge. They will no longer, they don't see your baby there after that. So they want to also be sure that your baby's being seen. They care about your babies too. They don't want anything to happen. So,
right. So there may be some facilities where you would be seen by your doctor or someone from their group.
We used to do that.
Just questions to ask.
We used to have a few private pediatricians that would come in, and we'd have to call them and let them know, like, hey, we had a baby born last night. Yes. You can come see it. So if your doctor does that, or the pediatrician that you are choosing does that, phenomenal. Then they can know, and then we can let their office know. But usually that's not the case these days. So again, we talked about choosing somebody. Location. You don't want to be driving your kid's real sick, coughing in the car, you're not feeling good, everyone in the house is sick, so you want to get the baby to the doctor. Are they close by? Are you having to drive 30 minutes because you want this one specific office? Like, think about that when you're tired and miserable and sick and you have to drive your screaming, fussy kid to the doctor. And do they have same-day appointments? A lot of the times, your kid will be sick, and then by the time you make an appointment and get them to the doctor, they're fine. They're fine. They don't have a fever in 2 days. Like, they had a fever 2 days ago, So do they have same-day appointments? Can they do urgent type of visits?
Yes.
Yeah.
And, some doctor groups, like, in particular, Cook Children's in our area does have urgent care clinics on the weekends.
Yes.
And so if you're wanting to stay within a group, you can always check and see, do they have weekends? Or
do they have-
affiliations
I was gonna
with
say-
a large children's hospital.
Yeah, I was going to say a lot of the urgent care affiliations, sometimes they'll plop those up in the area, especially pediatric urgent care ones, just because, you never know when kids are going to be kids and things are going to happen. So yes, if they have affiliations at other urgent cares, would your doctor's office be able to access that information if they need to?
Yes.
Things like that.
Their views on breast versus bottle feeding.
Yeah, care philosophy. Just like when you're talking to your OB-GYN and you want to know, well, will they do this for you? Will they do that for you? How does your doctor feel about having your baby breastfed? Are they going to try to supplement with formula if you don't want that? How do they feel about vaccinations?
Exactly. That's a big one.
That's a hot button lately. Are they going to fuss at you or basically...
There are some pediatricians who won't.
I was going to say that will fire you as a patient if you are not getting vaccines. So make sure their infant care philosophy is something that you're aligning with, because you don't want that to happen. Are you wanting to do more holistic care? Do they offer that? A lot of offices now or groups are, chiropractors.
Yeah.
They're starting to do that. What do they feel about that? How do you feel about that? So make sure that's something
That's always interesting.
Yeah, yes. Yeah. So if you're choosing a pediatrician and you don't want vaccinations all the way for your kiddo, make sure that's something that they're okay with.
And telehealth is such a big thing.
Oh yeah,
do they do
telehealth? Yeah, so easy. I'm sure they'll be like, okay, well, yeah, we don't have an appointment with Dr. So-and-so, but Dr. What's-His-Face has a telehealth. Sure. So if you're okay with that too. So flexibility on both the, your end and the physician's end is amazing. Yeah. Or how the staff interacts. I've had a lot of great doctors, but the staff is just or vice
not
versa.
Good about returning phone
They're not
calls,
good about returning phone.
messages.
Yes. How organized is their office truly? If you go in and the staff doesn't know what's happening or things are chaotic, they're just not a well-run machine, are things going to get missed? Are you going to miss an appointment? Did they forget to call you about a result? Whatnot.
Yes. And, a lot of doctors' offices will have portals where you can communicate via apps. So
that's, new thing now.
If you're, technologically savvy and you can do that.
Get on the portal.
That's questions to ask. Yes.
Procedures, in-office procedures.
Oh, yes. And speaking of, what about circumcisions?
Frenotomies, I know.
Yes.
Frenotomies.
Like your baby has a tongue tie and is having a really hard time breastfeeding because it does cause that issue sometimes.
Sometimes you don't even know until you get home and you're like, oh, this is
right.
not
And that
feeling
might be
good.
an issue with a drop in weight as well.
And jaundice, so it all goes hand in hand. So.
And those are pretty simple procedures to do. And, our pediatricians in the hospital can clip the tongue tie. They'll assess for that. But I know that sometimes they do that, in the office as well.
Yeah. Do they do those types of procedures? Are you comfortable having it done there? Or would you prefer a physician that, will refer you to a different place? I mean, a lot of dentists I've seen do frenotomies. Well, they'll refer to a dentist if you don't want to do that.
Right.
If you'd rather have it done in the office, great. Same thing for circumcisions, if that's something that you're interested in for your child. Will they do it in the office? Will they refer you to like an outpatient? We have urology clinics.
Or you might get it done in the hospital.
Yeah.
Some do, some don't.
Some do, some don't, yes.
Always good questions to ask.
Yes.
So you're not caught off guard.
I'm having a boy, so what about this? Like type of thing. So, yeah. So our hospital used to do them. We no longer do them in the hospital, but so if your pediatrician will offer that, or if you have to go to a urology clinic, and offers procedures. We talked about telehealth, urgent cares. It's important for us to know your pediatrician as well. Like we need to know, even if you go for one appointment and then decide to change, fine, sure. But when we've talked about the newborn testing that we do while baby's in the hospital, if we get a result from that and you and your baby have been discharged a couple of days later, we need to call your pediatrician, or we need to tell the state who you went to see. Oftentimes it's nothing, it's not a big deal, but there are some situations that, like I've run into, they need to know the pediatrician, they have to call them immediately.
When it's important, it's really important.
There are some pretty horrendous diseases out there, genetic mutations, disorders that the pediatricians will need to know about immediately. So that is why it is important for us to know. I know we're going to harp on you in the hospital. Do you have a PD? Do you have a PD? Who is it? Who are you going to see? Do you have an appointment? Even if you don't immediately have an appointment, we need to know who you're going to see. And if for whatever reason your mind changes in the 1 to 2 days before that appointment, please call your hospital and let them know so that we can record that appropriately.
Yes. And I mean, there are times I've had our pediatric hospitalists not let patients go home early, or when they, when they really wanting to, because they did not have a follow-up appointment scheduled, and the jaundice level is kind of, they're on the bubble.
Yeah.
So have those appointments. If you really want to go home, get those set. I know there's a huge checklist and a lot of paperwork for you to do in the hospital, but
it seems like
important.
Yes, it seems like such an unimportant thing at the time, because you're like, okay, I can do this like tomorrow, or I can do this when I go home, but we really need it done as soon as you can get it done.
And sometimes they'll say, nope, you got to stay.
Yes,
you will do it tomorrow in the morning.
Yeah,
and then you could go.
I mean, those jaundice levels and weight checks for sure. If they're not, checked within a couple of days, detrimental things can happen, especially for jaundice levels. Yeah. That jaundice level can spike, and it can cause really horrible things for your baby. And same thing as before, insurance-wise. Insurance is important. Are they going to take your, CHIP, Medicaid, whatever you have? Are they going to be able to see you for that? What are they going to be able to do to help you? Is your insurance changing? Are they flexible with that as well? Insurance is a huge part of care for anybody in general, humans these days, but
it's a pain in the rear.
It's a pain in the rear, insurance.
But it's a real thing.
It runs the world, and it's so frustrating because you can't always choose what you want. You just have to choose what's in your means, what your insurance will allow for you.
We can't let the doctors just be doctors.
No, we have to have insurance let us know what we're allowed to do with our lives, but
it is what it is.
Also, if they have cash pay, some people, you want to go to a certain office, but you don't have insurance. Do they have a cash pay option? Is there something? Are they gonna lots of hidden fees?
Yeah, sometimes that's be a pretty money saving. Yeah, it can really be.
Concierge medicine is such a huge, it's growing. So I'm excited about that, but it's almost like it's like a gym membership for your healthcare. No joke. My previous doctor did this. She had switched over from her regular practice to concierge medicine. You pay so much a month, and you can, for however many in your family, go in for this many appointments. It covers 75% off imaging, 90% off lab work. So you just pay a little out of pocket for those things. I know. And now they have pediatricians that do the same thing, or they can come to you in-house. If they don't have an office that you don't want to go to, if you want them to come to your house, there are pediatricians that do that now too. I think the one
That's amazing. I didn't know that.
Well, I was looking up something and it came, I think it's like modern pediatrics, something like that. I remember there being like a little whale icon. That's all. I got to look this up. But modern pediatrics, I believe is what it's called. It was a little whale icon. I'm sure we're going to find it in just a minute. But yeah, they do in-home visits. They'll come to your house, you know, and I've seen it in like our area and like the Austin area. So I'm sure other larger cities are going to start.
Wouldn't that be so cool to have something like that? Even just for our postpartum moms.
We talked about that.
I know.
That would be an amazing thing to do as like a.
I want to be a part of that.
I know.
I think that's so cool.
Do you need help? Are you bleeding too much? You want me to come in and check? I'll check.
Yep.
Concierge mentioned what I was going to say something else too. So yeah, I lost mine off the cuff. But
the whale.
well, I was going to say if you're doing that, if you're doing home visits, you're having a physician come to your house, check their certifications. And actually, this is for all physicians. I'm sorry, not just your home pediatrician. For all physicians, check their certifications. If you need special cares, or your child needs special cares, or you as a about to deliver if you're pregnant, check their certifications. Are they certified in certain things? Are you going to need that? You know, their board certifications. How long have they been in practice? Their experience. But to backtrack, if you've got someone coming to your house, make sure it's a safe person. Like, look them up, do lots of research on them. I'd say make sure.
There are bad people in every profession and every.
This is true. Yeah, you never know. And you don't want to be that poor, unsuspecting person just wanting a pediatrician to come see your baby at home. So, yes, lots of research on that. Make sure they're all certified. But mostly it's about safety. We want you to have a safe, healthy pregnancy. We want your baby to be safe after delivery. We want you to have really the best care with whatever way, shape, or form you're going to do that. We just want you to have the best care. So, what else? It's lots of doing research.
It is, but it's important.
Yes. I'm one of those people, like I'm trying to get another doctor for my husband, and I'm trying to get him to a different office. And so I'm the OCD person that's going to get online and look at all the doctors and see what their specialties are so that I can identify which particular one I want.
You'll be making an Excel spreadsheet.
If I was good at Excel, then I probably would. But otherwise, I'm just the old school, like, let's make a list. Yes. Pros, cons, location, whatever. So ultimately, it's about the care.
Yes, absolutely. I think that pretty much covers the big points.
Yeah, of course, if you have any questions, we can try to help direct you in whatever, or if you've got questions about what happens or what in the hospital, like what the pediatricians do in the hospital. We can't speak to every entity, but we can tell you kind of a basic gist, If you want to call the hospital and ask, I've had a lot of to-be moms call and, hey, do you do circumcisions? Not anymore. Or if your baby's admitted to the NICU, yes. But otherwise, on the well baby unit, not anymore.
It's not worth it.
No, it's not worth it. The NICU stay is not worth the circumcision if you desire it. But yeah, so you can always call the hospital and ask, what do they do, if that's something, what they offer.
Absolutely.
And we have a list for our moms, like if you've a lot of moms have come into it just completely blind to the pediatrician unless they already have kids and they already see a specific pediatrician that they're used to. A lot of people, like our first-time moms, will come into it blind, which absolutely floors me. Like you don't want to come into it blind. You want to have your pediatrician. More often. It is. When I get a mom or a couplet or mom or family that tells me, "Oh yeah, we've talked to this pediatrician. We love so and so. We're gonna go see them," and I'm like, "You're amazing. Kudos to you." So, but yeah, a lot of them come into it blind. So we've got a list that we show them if it's really a jumping off point. There's so many pediatricians in our specific area. So look and see what's available.
But even
to you.
we have a list of physicians in the area.
Just the area. Yeah.
And one side is physicians that take Medicaid, and the other side is physicians that take insurance.
Private
So,
insurance,
it might be worth just calling to ask, wherever you plan to deliver, if they have such a list, so they can kind of help you narrow things down.
Yep.
So,
Because if you're delivering like 30 minutes away from where you live, you may not necessarily want a pediatrician 30 minutes away. You may want someone a little bit closer. There's lots of clinics and offices usually like around the area. But anyway, so yes, drop us a line if you let us know if you've got any questions or any concerns about what your hospital may not have, or what we can answer. Let us know.
all right. I think that's it.
Bye, guys.
Bye. Thank you for listening today. The Rattled Nurses podcast is not intended to provide medical advice. It is not endorsed by our employer, and we are not speaking on behalf of our employer. Our commentary and stories are our own.
Also, on a serious note, we want you to know that if you are feeling blue or depressed, it is okay. You're not alone, and there's always someone to reach out to. You can call the National Maternal Mental Health Hotline at 1-833-TLC-MAMA, or text the crisis line, text HOME, HOME, to 741-741. Remember, you're doing a great job. Now go warm up your coffee.